Histamines. So that's a little tiny Pandora's box, but a really important one, because I find that a significant portion of the population genetically don't break histamines down well. If you've done your own genetics, either like a Ancestry or a 23andMe, you can look into the MAO or DAO, diamine oxidase or monoamine oxidase genetics, and see if you're heterohomozygous for that. Generally, if you're a carrier for either or both of those, you're going to manifest or have a probability of manifesting to some degree histamine intolerance. So what does that mean? What is a histamine? Classically, when we hear of histamines, we usually think itchy, scratchy eyes, throat, producing mucus, and seasonal allergies. And that's true. Those are all allergies related to overexposure of your body to its own histamine load, because the body was responding to something that it was exposed to. We have a member within our white blood cell family called mast cells. And mast cells actually contain histamine. Histamine is a useful tool to the body to kind of wall things off, or to try and create a constriction of something that's trying to invade the body. And that's one of the ways that the body uses histamine, because it creates a swelling. Now, when it gets out of hand, it's miserable. Your eyes are all puffy, your throat swells up, and it can create problems. And so they've developed a whole line of medicines under that antihistamine category. And they found a variety of different uses for those, from things like postnasal drip, sinusitis, chronic congestion, even vertigo because of swelling in the inner ear. So there's a lot of different ways that histamines or antihistamines can be utilized when we're talking about from the neck up. Normally, when I'm talking about the DAO and the MAO concept on histamine, I'm talking about from the neck down. And that's because the DAO family is generally presenting itself via our joints. So folks that mismanage diamine oxidase will commonly experience joint pain relative to histamine consumption. On the MAO side, those individuals are going to be more psycho-emotional based, where they're interrupting their body's ability to manage GABA, dopamine, and serotonin. So it affects their neurotransmitters. Now, the common rate-limiting step for both of those genes, if you're going to hack it, turns out to be a very short list of micronutrients. So vitamin B1, thiamine, B2, riboflavin, B3, niacinamide, magnesium, and SAMe. Those are kind of the key rate-limiting steps for MAO and DAO. On the DAO side, for years we've used high-dose niacinamide to help people with joint inflammation. But we've also found that if you can help an individual to understand what they're consuming that might be provoking some of this inflammation, well, they can make some appropriate dietary choices and avoid some of those foods. Sometimes if it's a food-based trigger in this histamine category and people consume alcohol, one of the tells or the obvious signs would be facial flushing if they're consuming things that are high histamine containing drinks. So that would be like red wine is a real high one, champagne is another one, but technically any form of alcohol can do that, but the longer it's been fermented, the higher the histamine value. And that term fermentation really applies to the whole histamine category. So you can look at like kefir, sauerkraut, kombucha, all of the alcohols, cheeses. The more aged, the more probability of creating a bottleneck metabolically. So those would be all foods that contain histamine that you're actually putting into the body. On the flip side of that coin, there's things that release histamine. And this is going to be like your tomatoes, and think of things that can ferment the longer they're around. So like people will say, I made a pot of spaghetti, you want to come over tomorrow and eat that? Well, tomorrow that thing has had a chance to ferment, and it's usually tastier on day 2 because of the fermentation process. But that also raises the histamine value. And it doubles down again if you eat it on day 3. So the longer foods have been around, the higher the histamine value. And some of our patients are so intolerant to this concept that if they make something that has the potential for fermentation, I encourage them to literally freeze the food if they're going to have leftovers immediately after cooking, so that it doesn't ferment in their fridge, and then they would just reheat it the next day and try and consume it within 2 days. Ideally, you would just consume things all in one. So I mentioned the foods that contain histamine. There's also histamine-releasing foods, and that would be things in the seafood category. So you've got like your shellfish and other seafood. I mentioned tomatoes. There's honeydew, watermelon, strawberries, raspberries. I mean, if you go on and you Google histamine foods, the list seems to go on forever. I try and guide people into what I would consider the 800-pound gorillas and say, okay, these are the foods that have the highest probability of creating a burden on your pathway. Now, the goal isn't necessarily to not eat any of those things, because it's not necessarily an allergy, although it can be. I mean, you could have both, a histamine intolerance and an intolerance to the food due to immune response, but it's not always that way. And so the goal really is to have as broad of a diet as possible without being reactive. And so that would entail just understanding what the menu is and making appropriate choices. So like if you're out to eat and it's say an Italian restaurant, you might not do like chicken parmesan with extra Parmesan cheese, marinara sauce, a glass of red wine, and a salad with balsamic vinaigrette, because everything I just said is histamine. Now, let's say you did that. What can you do to kind of hack it? Well, there's actually enzymes that you can take. There's one called HisDAO, which actually is the diamine oxidase enzyme. You can also take those 5 nutrients that I mentioned, and I find that niacinamide and riboflavin tend to be the heavier hitters there. And so helping people to kind of dose that appropriately relative to their genetics is one of the things that we work on. And most folks find that there's kind of a happy zone where if they've reduced their total intake of histamines and exposure to that, and they're supplementing appropriately, that much of their inflammation starts to come down. Why do we have histamines in the body? Well, I mentioned from the neck up. On the neck down, I really think it has to do with starting the digestive process and some of the needs for the ability to make and feel life. I should say, the inflammatory process regulate itself. So histamine naturally gets released in a small amount in our stomach just as soon as we consume food. It actually helps to initiate release of gastric acid in the stomach, which then helps to release a little bit of bile from the liver, which then helps to talk to the pancreas to release pancreatic enzymes. So it's this sequela of events that should be going on once we stick food in our mouth. The problem is some people don't tenuate that. They don't turn the process off. And so that's kind of like sticking your key in the ignition of your car, turning the starter, and then not letting go of the key. So you're kind of grinding that starter and you hear it make that horrible noise. That's too much histamine in the GI tract. And so sometimes we need support by giving the body those enzymes like the diamine oxidase, or giving the body the chance to make the enzymes, so like taking niacinamide and riboflavin and reducing your total load, to get the digestive tract to work well over time. I hope that answers that question. That was kind of broad on histamines, but I think I hit all the salient points.